Are we live? Okay, cool. Hi guys, we are doing a Facebook Live, like you hadn't already guessed that, video about adjusting kids, chiropractic for kids. And here in our clinic we treat lots and lots of kids. I've adjusted my own kids since the first couple of hours after they were born. And we have two of our absolutely favorite kid patients here. We have Lulu and Max. And I just looked on Max's chart. We just passed your 3rd year anniversary since you started treatment here on December 5th, 2016.
Wow, that's amazing.
Yeah. So it's going to be pretty simple. I will talk as I adjust Max. Actually, let me show the activator first, for those who aren't familiar with it. Some people are like, oh my goodness, is that going to hurt my kid? This is what we use primarily to adjust patients, especially kids, called an activator. And there's no needle on the end, and basically just gently taps the bones into place. It doesn't feel like it does much of anything, but on the inside of the body it really makes a difference. So it's very safe, very gentle. Does it hurt when you get adjusted, Max? Lulu, does it hurt when you get adjusted? No. Lulu, can you show your little chiro clicker?
Yeah, adjust my hands. I'm a massage therapist, so my hands hurt. There you go. Oh, that feels so good. Okay.
There we go. We get the kids' version. It's a toy. It doesn't really do anything. Okay, so you can lie face down here. Now, Max has some knee issues because he is a gymnast extraordinaire and a kid, in fact, a middle school kid these days, from what I hear. And so what I do is I feel each segment of the spine, but also any of the other arm or leg joints that may be giving symptoms, maybe hurting or aching or feeling unstable. And everyone is still out of place. I line the activator up specifically in the direction of that joint to tap it back towards where it's supposed to be, and that lubricates the joint, but it also takes pinching off of the nerve that goes through the joint. For example, right in here, these nerves go to the heart and the lungs. So by removing, it's pretty stuck in there today. By removing the irritation to these nerves, it helps him breathe better, and it helps his heart beat more efficiently, which keeps it young and healthy longer. And we don't mind commotion here in our office. Since we have lots of kids, if you're a parent, you know what I'm talking about. We just kind of go with it. But the vast majority of our kids, especially these guys, super well behaved. So what I found mostly stuck today was kind of right in here today, Max. You could hop up. How did that feel?
Good. Something else has been bugging you? I know you've been talking about your knees. What about your wrists or anything? You've been learning back to tuck. Oh yeah, your wrist.
Hold on.
Yeah?
Yeah.
Okay, want to look at your wrists?
There's a Lulu on there. Lulu, may I have my
Switch foot.
stool, please?
Switch foot.
Thank you. Both wrists or your right wrist? When you're doing the thinker position.
Just, I think only this one's the only one that pops.
That was the one that you landed on a couple years ago, remember that?
Yeah.
Yeah.
Some people say, oh, I thought you could only adjust the spine. But no, pretty much any joint in the body can get misaligned. And if it is misaligned, then it should get realigned. Let's check this out. Relax. This one's out a little bit, not a whole lot. Totally relax. There we go. Good. Ta-da! You're all healed. Then to keep things sanitary, even between brother and sister, I like to spray down a little alcohol.
It's your turn next.
And then I will put in the notes on the computer next after a little bit. Lulu, come on down.
Want to take your jacket off?
Oh.
That was so you could get the assist.
Lulu's
And
still wearing
also
her
because
pajamas
it's-
because it's Christmas break. So.
As she well should.
She'll maybe get dressed when she's got to go back to school. We'll see.
Thought about wearing mine today, but I knew we had the video shoot.
Lulu, is there anything bugging you?
No.
Alright.
Okay.
Lulu got a trampoline yesterday, so she's been jumping around a lot, knocking into things.
Dad
So you've
played-
already gotten to test it out. Do you like your trampoline?
Mhm.
You can bring your hands down. Down here is good. That allows these muscles to all relax. Have you guys both been jumping on it a lot?
Yeah, even Dad came on it and double bounced us.
Yeah.
Double. Yes, he double bounced Lulu this morning and she fell into the net, so.
Got it. That answered my next question as to whether it's just a kid trampoline. You are in better shape than your brother, but you guys have the same area that's most stuck out of place, which is the upper back there, which is not uncommon when you've been trampolining. All right, you can hop up. That was nice and easy.
No, it's my mommy.
Oh.
Lulu, how did that feel?
Oh, good, very good.
Awesome. So, some people say, well, is chiropractic, why would a kid need to get adjusted? They don't have work injuries or car accidents usually or things like that. But kids have spines. And aims similar to mine. Okay. So with the spine, obviously we've got all these nerves that come out from the spine. You're at least staying consistent there, really. Okay, I think that's almost intentional. When the bones get shifted out of place, whether it's from trampolining or even just being born or backpacks or whatever, it can get these bones out of place that can start to pinch the nerves, and that interferes with the brain's communication with whatever, like I was saying, whatever part of the body that nerve goes to. And so chiropractic is not just for back pain, it's for nerve stuff. So as we gradually get the joints tapped back into place and take the pinching off the nerves, then the whole body gets healthier. It doesn't cure everything, but it's a really important part, like massage is, of natural healing for the body. It doesn't create perfect accuracy with basketball shooting, though.
Almost.
So, anything you would like to say?
Yeah, I was thinking about, because I'm surprised it's already been 3 years, but I started coming here 3 years ago. And I started coming because I had some pretty bad discs that were caused in part from a very mild case of scoliosis that I had as a child that was never really diagnosed and certainly not addressed. And so after years of wear and tear, you have that extra torque on your spine. It really wore out my discs, and I thought, well, that kind of thing might be kind of genetic, so let's bring the kids in. And sure enough, we got some x-rays and their spines looked a lot like mine did. And so I'm glad we started getting them in, and now that he's doing gymnastics, obviously it really helps. You are really bad at that. really bad at that.
Very consistent, yeah.
I'm hopeful that by bringing them in for chiropractic, they can prevent and avoid some of the injuries that have occurred to my spine. But also, I remember when Lulu was an infant.
What's an infant?
Like a newborn. You were brand new baby, and she had. I was trying to breastfeed, and she had a really hard time latching. And my midwife said, bring her in for a chiropractic adjustment. That sometimes can help. But I brought it not to here. I just called any place that was open that day, and I brought her in, and they adjusted her. And I don't even remember how they did it because I was like. I was sleep deprived, but it did. It seemed to help a lot. You were so bad at this. It seemed to help a lot. So that was her first chiropractic adjustment, and then didn't come back again until she was 4 here. But it definitely keeps them healthy, especially during like cold and flu season when they're coughing a lot. We were talking about the nerves that go to the heart and the lungs. So that helps keep them healthy and fit. And
forward.
No.
Turn around. There you go.
oh, you're so bad at this. Anyway, so I'm really glad that you guys can come in and stay healthy and keep your backs adjusted.
And I think that was Dr. Rachel Medford.
I think
wasn't it?
that sounds right. Yeah.
Yeah, it was just awesome, and she's great with kids as well. Yeah, super. So, if Max and Lulu, do you guys have anything else you guys want to say?
No.
Okay.
Happy
so
holidays.
I'm really bad at this. I love cats and I'm awesome.
You are awesome.
okay, this is true. So, what I'm gonna do is go over and get somebody else adjusted who's even littler than you guys. And Lulu can keep going until she finishes, and then around New Year's, we'll be back in to see how it's going.
Oh no, I did it.
Perfect.
Good, now that he's been changed. So here we have Jacoby and Oliver. And Oliver is how old now?
He'll be a month on Sunday, so in a couple of days.
Yeah, he's like 4 weeks old. And Oliver got his first adjustment when he was what?
A week old.
1 week? Yeah.
Yeah.
So he's been getting. Why did you bring Oliver in to get adjusted?
Because when babies are in the womb, they're all packed up
Smushed
and
up
smushed.
again.
So I figured probably does some damage over the course of labor and everything. So
Yeah.
why not?
And the
And I've read the studies of how it helps everything, and over time, if you don't get them adjusted, what can happen,
yeah,
illnesses and stuff like that. And
right.
especially like if you want your kid to be like athletic and things like that, it can cause things down the line that could have been prevented from the time they were born.
Right, yeah. It's great to catch problems as they're just beginning. Both being smushed in the womb and the coming out process can be pretty traumatic. Not just, lots of changes, but also just the physical pressures and twisting and things like that. And that's where babies often get their first subluxation, that misalignment in the spine that we were talking about, is during the birthing process, or like Jacoby said, sometimes before. So let's see what's going on with Mr. Oliver today. I'll go around from behind so you can see his cute face. Because there's not much exciting to see here. I'm just doing the same thing that I just did with Max and Lulu. It's doing better. That area right in there, which is kind of right in the mid-back, which is related to digestion, the nerves that go to the stomach, was kind of stuck today. Real mild one. He does have this this nice startle reflex here. And then we check this delicate little neck. See what may be out of place. And there's one right here. Just mildly out of place. Sometimes I'll click it in the air just to get him used to the sound. There we go. Okay, and he's all finished. That easy. Did it look like he suffered through this adjustment? No, not at all. Sometimes the sound, like you saw with Oliver a moment ago, can be, it's a quick sound, and so sometimes it can be a little startled. He's a little startlier than normal.
Yeah.
Kids. And so this is the normal reaction of a baby after an adjustment, which is like, oh, what happened?
And then he sleeps a lot.
Yeah, right, yes, a lot of babies do after their adjustment. So thank you guys for joining us for this Facebook Live about chiropractic for kids.